It sounds really shocking to a lot of folks, but Dr. Susan Kolb, specialist and author of The Naked Truth About Breast Implants, says she sees this quite a bit, and she joins us now on Skype. So, Dr. Kolb, this is something that you've really come to specialize in, treating women who have this problem. So you say you're seeing this quite a bit. Is that true?
That's true, Dr. Travis. I have a number of patients that have problems getting rid of the biotoxin. In fact, 25% of the population can't get rid of the biotoxin with mold. So even if you have a little bit of contamination of mold, they can get very, very sick with a neurological and fibromyalgia type illness, even if the implant is not black. And I have in fact seen hundreds, if not thousands of patients ill because of this biotoxin problem with saline implants.
I mean, Dr. Kolb, are you now totally anti-implant? Is that what you're saying?
No, not at all. I'm not anti-implant, but I think we need to do more to educate both the patients as well as the doctors, and not just the plastic surgeons. They often go to the emergency room, and the ER doctors have no clue what's going on either.
Well, Dr. Kolb,
so we have to educate all of the doctors about biotoxin illness in patients with breast implants.
Well, I couldn't agree with you more that as plastic surgeons, we have to be doctors first, and if a patient comes in after augmentation and has any change in symptoms or the breasts appear different, then it's our obligation to work that up, and if necessary, remove it and investigate.
And Dr. Kolb, you shared with our producers before this segment that you yourself have implants, correct?
That's correct.
And can I ask, are they saline or silicone?
Currently, I have saline implants that probably will need to be changed out every 10 to 15 years in order to be safe.
Dr. Kolb, thank you so much for sharing your expertise and experiences with us. Really quickly, because the symptoms are so nonspecific as they were in you, Ann, you mean no one's sitting there putting a unifying diagnosis together thinking, oh, this is obvious. You know, I potentially have mold in my breast implants. How would you even go about working this up? Or as Dr. Kolb eloquently pointed out, a lot of times you might show up in the ER. Here I am an ER doctor, and you have all these non-specific symptoms. And, you know, through the history, you find out, okay, well, breast implants have been there for decades and decades, and there's some soreness there. Because it's not like you just, you know, cut open the skin and look and say, yep, there, you know.
Well, it seems like there were some abnormalities that they found on a mammogram. So that right there in itself is boom, it's time to go in there, operate, investigate, something is not right. Okay. You may have a normal mammogram, though. That makes it more difficult to decide what you want to do. But nowadays, I think with stories like Ann, that with these symptoms, with an implant that's been in there for years and years, you're best served just say, you know what, it's time to swap these implants out. This may be, and you know, we'll never know if in fact these implants were the cause of your symptoms. I mean, the proof of the pudding, you should get better if all of this is eliminated from your body, or is it just that you are reacting in a certain way to this infection?